Medical staff killed, hospitals targeted, and patients operated on without anaesthesia. This is the grim reality of Israel's bombardment of Gaza's medical system. Hello and welcome to Roundtable. I'm Enda Brady. Now, Gaza's healthcare system has been struggling for years from Israel's blockade. It has now reached a critical crisis with Israel's ongoing strikes on Gaza, including hitting hospitals. According to the UN Health Agency, only 17 of Gaza's 36 hospitals remain partially functional. So, when will the systematic dismantling of Gaza's health system actually end?
Every day, more people inside Gaza are killed and injured as a result of Israel's military offensive. In the last 12 months, Israeli forces have killed over 41,000 Palestinians, including 1,151 working in Gaza's health sector. And more than 22,500 people have life-changing injuries requiring long-term rehabilitation services. There has been no respite for medical staff as Israel targets Gaza's hospitals.
We receive daily cases of second and third degree burns as a result of rocket attacks and the use of internationally banned weapons. Most of the cases that come to us are children and women. We don't have any capacity to deal with these burns.
Hospitals are also facing an acute shortage of medical supplies and essential drugs.
In Gaza, a catastrophic health crisis continues to unfold. While levels of life-saving aid remain grossly insufficient, we cannot deliver humanitarian aid anywhere close to the scale that is needed. While Gaza is under heavy bombardment, our humanitarian operations continue to face denials of access, delays, impediments, and multiple dangers.
As the humanitarian crisis worsens, it is ordinary Gazans who continue to suffer.
Even medical treatment we can't find. There is no treatment offered here. I'm injured and there's no treatment. Where should we get it from? Where should we go?
Israel justifies the targeting of hospitals in Gaza, like Al-Shifa, on the basis of targeting Hamas commanders.
Hamas wages war from schools and hospitals. Hamas hopes the international law and public sympathy will provide a shield for their military activities, which is why they systematically operate from schools, UN facilities, hospitals, and mosques.
But under international humanitarian law, the targeting of hospitals, medical staff, and ambulances is illegal. With Gaza's healthcare system on the brink of collapse, has the international community failed them?
Well, let's meet our guests. Joining us from Geneva is Dr. Margaret Harris. She is spokesperson for the World Health Organization. In London, we have Shazia Arshad, Head of Communications and Creative Content at Islamic Relief UK. And I'm delighted to say here in the studio with me is James Smith, an emergency doctor who worked in Gaza from December to January and then from April to June of this year. And Amira Nimerawi, who is CEO of Health Workers for Palestine. You're all very welcome to Roundtable. James, I want to come to you first. As a doctor on the ground working day after day, week after week in Gaza, just give us an indication of what your working routine was like.
Sure. So I had the good fortune of working in Gaza twice in the last 12 months, and on both occasions was working alongside Palestinian healthcare workers. My perspective is drawn from that brief 2.5-month period. I think the thing that's worth being very clear about is that our Palestinian colleagues have not just lived every day of the last 12 months, but they've, of course, lived through the period that preceded it, which was far from perfect. Every single day that we were working at the hospital or in the sort of pre-hospital clinics and facilities, there was a fear and anticipation of what we might encounter. You didn't know if that particular day you were going to be treating the victims of a mass casualty incident, if there had been an airstrike in the nearby area, or if the hospital was going to be overwhelmed with wounded that had moved from another hospital. My final days in Gaza, I was working at Al-Aqsa Hospital in Deir al-Balah, which is one of the few remaining hospitals that retains some degree of functionality. And I worked again with colleagues that I had worked with in December, and they were fatigued. Many of them were clearly deeply, deeply traumatized. They were working every day to treat hundreds of patients, many of whom presented with the most horrific injuries that I have certainly ever seen. And the sort of repeated traumatization of witnessing, but also of trying to do the best that you possibly can with what limited resources are available to you is almost unimaginable to people that have been fortunate enough not to encounter what's currently happening in Gaza.
Amira, the healthcare system in Gaza was on its knees before the war. It has effectively now been dismantled.
Yes, so I would say it has been completely destroyed, and you're quite right, and as James alluded as well, before October last year, our colleagues and peers in Gaza have been calling out for help for the last 16, 17 years because of the blockade and the siege that was imposed on the healthcare system. And so what you see now was an already struggling healthcare system that has been deliberately and strategically targeted to be completely destroyed, so that we have an effect where there's fast genocide with the direct bombing, and then now we have the impact of the slow genocide where people are essentially dying from preventable diseases or experiencing complications from things that could be easily solved with, say, something like antibiotics, for example.
Margaret, how frustrated have you been watching from afar, seeing everything that has been unfolding for the population of Gaza, but the hero medics who are out there doing their absolute best in extreme danger every day?
Frustrated is exactly the word, and devastated because we are feeling so hopeless in the face of what we know is so wrong. That hospitals being attacked, healthcare workers not being able to have the basic supplies, the bandages, the intravenous fluids, the antibiotics, the pain relief to do their job. The worst thing you can ask, and I'm sure James will tell you, of a doctor is to have somebody desperately in need of care, knowing what to do, but not having the means to do it. And seeing someone in pain, you can't relieve, seeing somebody bleeding out, but you can't stop it simply because the things are not there, or because you've got 20 other people coming in at the same time as well. So all these things are so terribly wrong. It's very, very clear over and over again. We've seen violations of humanitarian law, and we've described it. We've advocated for it to stop. My Director General says I would say every day, peace is the only solution, and peace is the best medicine. But it seems to be falling on deaf ears, especially the ears of those who could do something about it.
Shazia, I would imagine you have had a huge amount of donations in the past 12 months. Talk to me about the difficulty of getting the actual medical supplies and everything you want to get into Gaza and being blocked from doing so.
Yeah, I mean, the last 12 months have been incredibly difficult in terms of aid access. And we have to remember that we're talking about, as everyone's already alluded to, very clearly, Gaza has been dealing with restrictions of movement and restrictions of aid coming into Gaza Strip for many, many years now. But what we've had to deal with over the last 12 months is this being stepped up significantly. We have not been able to get in the level of supplies that we need. We haven't been able to get in the levels of aid that we need. And yet what we have had to do is ask our teams to continue to operate with the supplies that they have and try to distribute what they have and, try and meet the very bare need, the very basic needs of so many vulnerable people. But that's becoming increasingly difficult. And when we then hear, terrible horror stories, of very sick people, very injured people who aren't able to get the necessary items that they require, it's very difficult for us because we know that it should be possible for us to get that aid in if the restrictions were lifted, if the siege was lifted, and if we were able to get that aid in very quickly. At the moment, our hands are tied because aid access is so massively restricted. What we need to say very clearly to the international community is that there needs to be significant pressure to ensure that restrictions on aid access are lifted, the siege is lifted, and that organisations like ours and the many other humanitarian agencies that are operating in Gaza are able to do their job as quickly and as effectively as possible, because it's the only way we're going to be able to save any lives at all.
James, I was hugely struck this year by the resilience of the medics in Gaza, turning up for work day after day at great personal risk. I mean, I know doctors take an oath when they start their careers, but this was above and beyond anything we'd seen before.
Absolutely. I mean, there are a couple of things to say to that. Resilience, yes. Determination, yes. And the Palestinian healthcare workers that I spoke to at length about these kind of things, I mean, there is a professional commitment, as you mentioned, but there was also a deep commitment to Palestine and to the people of Palestine. Many people I spoke to recognized the inherently political nature of medical practice, of care under fire, literally under fire. And that was really what motivated a lot of people to keep coming to work. The other thing I think that is worth being clear about, though, is that resilience is a double-edged sword. And I think a number of commentators, many of whom are Palestinian, have really emphasized that there is a risk that we over-emphasize the resilience of the Palestinian people, which has the indirect effect of opening up space for yet more violence, yet more traumatization. To say that the Palestinians are an exceptionally resilient people somehow it excuses the violence that has been meted out against them. So I think we have to walk that line very carefully. I absolutely saw resilience. I saw great determination, the most phenomenal commitment to delivering the best possible care under the most austere circumstances. But a resilience that, of course, it's incredibly depressing that people have ever had to generate such resilience in the first place.
Amira, at some point there has to be a ceasefire, and then there will be a conversation about reconstruction. How on earth do people go about rebuilding a healthcare system that has been systematically destroyed?
So I think absolutely the first step needs to be sitting down with the Palestinian healthcare workers and working not with them, but putting them essentially into the position of being leaders when it comes to developing that blueprint and supporting them in that endeavor, and working with organizations like the World Health Organization, who lead the health cluster that exists across Palestine as well. And I just want to take that just a quick moment to highlight that the resilience of the healthcare workers is not just in Gaza, it is across Palestine, because in the West Bank, we have seen actually a higher number of attacks on healthcare, specifically across the West Bank since October, but also between 2018 to 2022, it was actually the highest number of attacks on healthcare. So just to sort of paint that picture of the healthcare system as a whole, and it should be seen as a whole, it's not just Gaza and it's not just the West Bank, and it shouldn't just be separated to East Jerusalem either. It's looking at a Palestinian-led healthcare system. And this is a really important piece of the puzzle when we're talking about Palestinian sovereignty, because we know that the occupation is essentially targeting our healthcare system as a means to control our bodies. Now, they're either doing that by killing us or putting us in a position where we're ill or we're maimed. And we saw that with the Great March of Return in Gaza, where they were deliberately targeting the limbs of the youth that were protesting peacefully. And so what you have is this already existing inherent imbalance of power between the occupier and the occupied, being exacerbated even further because you have a population that are now facing disabilities. You know, we have 10,000, 11,000 children that are newly amputees. And so when we talk about healthcare, we need to look at, it's not just the hospital system, it's not just the supplies coming in. We need to look at also the social determinants of healthcare. That's education, that's the environment, that's access to vocational opportunities and the ability to self-determine. So first and foremost, it absolutely needs to be a Palestinian-led conversation. and then working with the other organizations and actors on the ground to ensure that this is a Palestinian-led initiative.
Margaret, can I ask you, at what point then will the rebuild start? Once there's been a ceasefire, talk us through your organisation's role in that. Where will the money come from and what will the international will be?
So, in fact, the rebuild is happening all the time. Many of the hospitals that have been attacked or even destroyed, such as the NASA Medical Center, have actually been, they haven't been rebuilt into a lovely, beautiful new building, but they have been put back into the bits and pieces that are needed. And I couldn't agree more with what we just heard. It's got to be Palestinian-led. It's got to be in terms of what is absolutely needed now. And that's why you don't wait for a ceasefire. You make sure that what people need now, such as a safe place to deliver your baby when you're a pregnant woman, such as a place to get your treatment because you've got cancer, or a place to get your hypertension treatment, your diabetes treatment, all those things are critical every day, and you can't wait for a ceasefire. We've got 180 women giving birth every day. Can you imagine? There certainly aren't the safe and clean spaces for that to happen. But the work to achieve that has to go on as much as possible right now.
Shazia, Islamic Relief will have worked in many, many difficult locations across the world. Just tell me, where does Gaza feature on the scale of that huge challenge you've been involved with?
I mean, this has definitely been one of the most difficult humanitarian situations that we've had to deal with as an organisation, and I think this speaks to, particularly the length of this crisis over the last year. It's on an unprecedented scale. Of course, we've as an organisation, we're responding to humanitarian crises for, as long as we've existed, for 40 years. But what this particular crisis has really brought home for us, but particularly for our team on the ground in Gaza, is not just the response that the teams have been leading day in, day out, but it's the fact that they've had to live through this terrible catastrophe that's been inflicted upon them over every single day of the last year. They themselves, the team themselves, have not had a moment of respite. They themselves have not had a moment to reset. They've had to continue working through it, and they've had to continue responding. And that's, I think, one of the things that's been particularly difficult in this situation, is that we're asking our teams to lead a humanitarian response for communities who are in absolutely desperate need, but they themselves have been displaced, they themselves have lost family members, they themselves have had to live through the worst, most unimaginable situations, and they have had to be resilient and keep going. And we talked to, we just heard there about resilience, and I think, we must be really conscious of how we use that word resilience, because I think it's very right to say that we shouldn't be expecting our colleagues, our friends, to continue to be as resilient as they've had to be, because this is not a situation that anyone should have to live through, and it is one of the hardest that our teams have faced in many recent years.
James, in the United Kingdom the last year, there have been medical strikes, doctors have gone on strikes, a lot of people saying they're stressed and underpaid. In all honesty, how do you feel hearing those conversations when you've seen firsthand what extraordinary stress is like?
Well, I think there's certainly political legitimacy to those strikes in the UK. I think what's important is to see actually that these struggles are in some way inextricably connected. The links may appear at face value somewhat tenuous. The stresses are, of course, of a magnitude different in Gaza. That's for sure. I wouldn't dispute that. And I think that what's incumbent upon us as a global or international medical community at this particular moment is that we manifest medical solidarity beyond the borders of the UK in such a way that healthcare workers in the UK, as many hundreds and thousands have already done, stand up and express their indignation at what is being done to health workers, not only in Gaza, but of course in the context of the ongoing occupation of Palestine and in other conflict and violence affected countries the world over.
And tell me, James, Did you meet many people from other countries? How many foreign medics wanted to volunteer their time and go and really help the Palestinian people in Gaza?
I worked with colleagues from Jordan, from Egypt, from the US, from Canada, several other countries. There was really, and still is, an outpouring of that internationalist support. And as some of our other colleagues have mentioned, I think that the limiting factor is that Israel has manufactured scarcity, material scarcity, but also human resource scarcity, such that all of those people that would otherwise try and access Gaza to provide that support, when that in this moment when surge support is needed, are simply unable to do so.
Amira, what are the long-term consequences of not having a proper healthcare system? So away from treating bomb injuries and shrapnel and blast injuries, there will be cancer, there will be diabetes, there will be the everyday, for want of a better phrase, illnesses and diseases that most doctors treat. These are presumably all going completely undiagnosed in the Gazan population.
Exactly. So with the extent and sheer scale of the devastation and the direct war injuries, if you like, we have seen a massive ballooning of the pressure on the primary healthcare system. So that's the system, to your point, that would be taking care of the everyday conditions that you mentioned. And so unfortunately, those teams also are completely under strain trying to deal with these particular types of cases. And our colleagues mentioned, for example, when we're talking about pregnant women, they don't have access to the prenatal care and the perinatal care and postnatal care that they need. And so we're seeing, just as an example, an increase in postpartum complications where some women have had to have hysterectomies because they could not stop the bleeding because they don't have the medications. We have issues with nutrition in these pregnant women because of this manufactured blockade that James was talking to. And so when we look at things from an epigenetic perspective, we're looking at the impact on the health of the child and for generations to come. And I think this is a really important point that we need to consider, that for every single person in Gaza, they will, whether they have a sustained a war injury or not, they will have some sort of health issue and complication that will have long-term effects, not just for themselves, but for their families and for future generations. And again, this is an intentional tactic because this is about ethnic cleansing at the end of the day. And when we talk about the healthcare system across Palestine, we have seen this impact for years. You have issues of medical apartheid where people are being denied the right permits to be able to go and seek treatment in a hospital in Jerusalem or outside of the country, for example. And children have been dying for years because they don't have access to kidney dialysis, just as an example. That obviously has now proliferated to an extent that is so extreme. You've got about 16,000 people that are on an officially approved World Health Organization list for evacuation, and Israel will not allow even the children who need access to cardiac care, cancer care, renal care, people that have sustained war injuries, children that have sustained war injuries. They are literally dying just because Israel is saying no to those permits and those evacuations from taking place.
Because they're Palestinian.
Because they're Palestinian.
Margaret, how concerned are you from a World Health Organization perspective about all of the undiagnosed illnesses that are not being picked up because there is no healthcare system functioning?
Deeply, deeply concerned. And we've already seen a very good example of what goes on silently. Polio wasn't in Gaza for decades. And then some wastewater surveillance, which was almost done serendipitously, found that indeed polio is now likely to be rampant. And we've got at least one child paralyzed already. And we had to mount a very large campaign because the virus was very likely to spread to other countries. Now, that's just one of the many, many viruses and bacteria, including bacteria that have developed resistance. So we're also concerned about antimicrobial resistance. It was already a problem in Gaza because exactly what we've been hearing. People were not getting all the treatment they needed. They weren't being allowed to get out of leave Gaza itself. And other sort of conditions. But we are very concerned that, again, antimicrobial resistance will be rising. We've seen a huge rise in hepatitis. We've seen a huge rise in meningitis. But again, those daily diseases, those things that people can live with for years and years and years. They get good management, good primary care. They're just not getting the care. And they're dying. We don't know how many of them are dying. We really won't know the impact until the end of this. But what I can tell you is the impact is horrific.
Shazia, final point to you. There will be many millions of people watching around the world asking themselves, how can I help? How can people help organisations like Islamic Relief who do so much good in Gaza?
I mean, there are, of course, there is the fundraising appeal, and we have a live fundraising appeal, and it's so important to get money in as quickly as we can, because in spite of the restrictions that we face with aid access, we are able to deliver aid on the ground. We have been able to do that over the last year, and we want to continue being able to deliver that because the need is dire, the need is great, and we need to upscale as much as we can, as quickly as we can. So making sure that we get in the money that we need to be able to ensure that our teams can do the job that they have to do so desperately is so important. But I think alongside that, the thing that we are constantly calling for is for people to write to their government and continue to call for a ceasefire.
Shazia, Margaret, Amira and James, thank you all so much for your insight on this. Remember, you can see more discussion and debate on our YouTube channel. Just search for Roundtable TRT World. But for now, from me and Brady and all of the team here, goodbye and thank you for watching.